Good day everyone, my name is Angela Imahinay, a second-year student taking a Bachelor of Secondary Education major in English. Today, I will be discussing about learners with physical disabilities, but before that, I have here the objectives. At the end of the lesson, the students will be able to define and differentiate various types of physical disabilities, identify appropriate teaching strategies for students with physical disabilities, and recognize the common causes associated with each type of impairment. What is physical disabilities? So these are the person with physical condition affecting how they live their life. Students or persons that have physical disabilities may have problems related to movement postures, grasping or manipulating objects, communications, eating, or even reflex movement. As we all know, the initial barriers experienced by children with physical disabilities is physically accessing to the world of learning or education. So let's now explore the four major categories of physical disabilities, starting with visual impairment. Visual impairment may be defined those children who are suffering from the impaired condition, difficulties, and deficiencies present in their visual organ, which make them different from children with normal vision to extent of requiring special education for vision. And to make it more comprehensive, when we talk about visual impairment, this is any kind of vision loss. This is the condition that causes problem or inability to see. How is visual impairment acquired? I will mention some causes, and the first one is transfer of genes associated with parents. Second, carelessness adopted by pregnant mother. Third, mishaps and accident. Fourth, unfavorable condition. Fifth, eye infection and eye diseases. And lastly, reading, writing, or working in defective and improper lights. Here are some teaching strategies for students with visual impairments. First, encourage the student to use visual aids or resources that have been prescribed. Second, use suitable lights. Let's always make sure that lights are suitable to those students with problems related to light. Next, use of enlarged print or magnified worksheets, and the printed materials must be clear and dark. Next, supplement visual material with clear verbal explanation, and lastly, increase oral activities. Next is the hearing impairment. Hearing impairment is defined by IDEA as impairment in hearing whether permanent or fluctuating that adversely affects a child's educational performance. In contrast, a child with a hearing loss can generally respond to auditory stimuli, including speech. This is often used to describe a wide range of hearing loss, including deafness. So earlier, I stated that visual impairment is a condition that affects our vision, and now, hearing impairment is a condition that affects our auditory. These are the types of hearing impairment. First, conductive loss. This refers to the decrease in sounds caused by a problem in the outer or middle ear. For those people who have this kind of condition, they may be hard to hear soft sounds, louder sound may be muffled. Second, sensory neural loss. This refers to the problem located in the inner ear or along the nerve pathway between the inner ear and the brain. If you have this condition, you have been trouble hearing sound when there is background noise, and trouble hearing high-pitched sounds, feeling like you can hear voices but you can't understand them. Next is mixes loss. This refers to the conductive loss and sensory neural loss occurring at the same time. When we're talking about this hearing loss, this is the combination of two hearing impairment, the conductive loss and the sensory neural loss. How hearing impairment occur? So the first is the gradual build-up of earwax. Second, ear infection and abnormal bone growth or tumors. Third, ruptured eardrums, and lastly, damage to the inner ear. Here are the teaching strategies with students with hearing impairment. First, use assistive listening devices such as induction loops. Second, ensure that any background noise is minimized. Third, repeat clearly any questions asked by students in the lecture or class before giving response. Fourth, do not speak when facing the blackboard. Mustache, birds, and handbooks or microphone in face may add difficulties of lip read. Lastly, provide written materials to supplement all lectures, tutorials, and laboratory sessions. Next is the speech impairment. This is the disorder of speech sounds, fluency, or voice that interfere the communication, adversely affect performance, and or result in the need for exceptional students' education. So these are the categories of speech impairment. First is the fluency disorder. Difficulties of rhythm and timing of speech characterized by hesitations, repetitions, or prolongations of sound syllables, words, and phrases. Next is the voice disorder. Problems with quality or use of one's voice resulting from disorders in the larynx. It is also a typical tone of voice. Lastly is the articulation disorder. So these errors in the production of speech sounds that may be related to the anatomical or neuromuscular support for speech production. So these are the teaching strategies for students with speech impairment. First, move kids closer to you. Second, give extra time to complete assignment. Third, substitute written for oral presentation. Fourth, use technology to make learning easier. Fifth, be patient when students with disorder speak. Lastly, talk about and celebrate differences. The last physical disability is the multiple physical disabilities. So multiple physical disabilities refers to the individuals who have more than one physical disability, often with varying degrees of severity. So common causes of physical disabilities are first, chromosomal abnormalities. Conditions like Down syndrome or Turner syndrome can lead to multiple physical disabilities. Second, premature birth. Babies born prematurely often face a higher risk of developing multiple disabilities due to underdeveloped organs and system. Third, infections during pregnancy. Certain infections contracted by the mother during pregnancy, such as rubella or cytomegalovirus, can cause multiple disabilities in the baby. Fourth, injuries. Accidents or injuries, especially those affecting the brain or spinal cord, can result in the multiple physical disabilities. So here are the teaching strategies for students with multiple physical impairment. First, understand their disabilities and strength. Use strength to motivate learning. Second, adapt the classroom. Modify setting, materials, and assignments. Allow partial participation in the class. Next is use assistive technology and related devices, services. Employ tools like specialized keyboards or software and collaborate with therapists. And lastly, focus on practice and clear instructions, provide hands-on activities, and break down tasks. That's all for today, and see you on my next discussion. Thank you!